Senator Moran.
Chairman, thank you. I'm glad the meeting is still going. I don't know that you're pleased with my arrival, but I'm honored to be here. Thank you.
I'm always pleased with your arrival.
Thank you, Chairman. Dr. Hodes, I'm not exactly sure what has been asked and answered, but I want to pursue a couple of concepts that are now developing in regard to Alzheimer's. We've talked about detection and the efforts to use biomarkers to identify someone who is at risk or has Alzheimer's before they begin showing symptoms. The National Institute on Aging just coordinated to propose a biological construct which looks at the use of measurable changes in the brain to better understand the earliest biological signs that lead to symptoms. How will this new framework help to drive research forward? Does it represent a new understanding of the beginning of the disease?
Thank you. Well, the importance of being able to identify the changes that accompany Alzheimer's disease and related dementias early, as you've emphasized, is critical, where we think that the best opportunity to intervene at an early point and be able to track success or failure of interventions by measuring biomarkers is going to be absolutely critical. The definition that you refer to is a publication which suggested that for the pathologic definition of Alzheimer's disease based on plaques, tangles, neurodegeneration, there is a set of biomarkers that, if standardized, would allow us to assess across studies, and both longitudinal studies and clinical trials, and in doing so, rigorously harmonize the results of multiple efforts, and so more quickly understand which biomarkers are best predictive of disease and, importantly, predictive of a response to intervention or treatment or not. So the studies that Senator Blunt referred to at Wash U are among those. Right now, the biomarkers that are most accessible, most widely used, are either imaging, which works extremely well but is cumbersome and expensive, or cerebrospinal fluid analyses, which works. But the goal of many now is to establish so-called fluid biomarkers that can take advantage of blood and serum and identify either a single molecule or a pattern of molecules that will allow us to screen many people, more than we currently can, through longitudinal studies and through interventions.
Doctor, thank you. Let me address this question to Dr. Collins. With the leadership of Senator Blunt and others, we have had success, in large part, I would say, because you all have made a case for additional resources within each of your institutes in which the public good is demonstrated and the advancements that are being made are sufficient for American people to feel comfortable that progress is happening and that we're on the cusp of developments that will make a difference in their lives. In the last year since you were here, Dr. Collins, in this setting, what can I tell my constituents that has transpired to reassure them that their tax dollars are being wisely spent? I sometimes head down the track in a town hall meeting explaining that there are things that we should spend no money on, things we should reduce spending on, and there are things we should spend more money on. And by the time I say that sentence, I'm wondering what my constituents are thinking about a senator from their state who's interested in spending more money on anything. Then I use NIH as the example. And one of the things that we've been able to do in this subcommittee and in the Senate is to prioritize our spending. So it's making decisions about where to spend more money, not just always the thing that I think many Kansans might think happens around here is just spending more money on everything. So, Dr. Collins, give me the town hall description of how successful our spending has been in the year since we last met.
I love to give that description. Thank you for the opportunity. One thing that I would say is maybe the most important discovery that happened in the last year is one we don't know about yet because it was a basic science discovery that sort of seemed at the time interesting, but we didn't realize until maybe a year or two from now just how profound it might be. We talked about CRISPR-Cas earlier. When that was discovered, nobody had it on their list of the big deal from that year. Another big discovery that probably we could mention for anybody across this table would be something that has just happened in the more therapeutic applications. In my opening statement, I told the story of a little boy who should not be alive, who's walking around and hanging on the monkey bars after being diagnosed with spinal muscular atrophy, a fatal disease, and which with gene therapy now appears to have had a dramatic response. I could say, well, let's talk about drug abuse. Just yesterday, approval by the FDA of lofexidine, the first non-opioid way to help people withdraw from opioids, which is an effort that NIDA and their colleagues had put together with industry. With cancer, the advances in cancer immunotherapy, which was already pretty good stuff a year ago. Oh my gosh, it's gotten so much more exciting now with the additional advances, as Ned could no doubt tell you. In terms of neurological diseases and advances in aging, some of the basic science of aging has also had some interesting findings in the last year about the normal process, not just when it goes awry. And certainly Dr. Fauci would say, well, goodness, where were we a year ago in terms of Zika and Ebola, and where are we now when it comes to such things as a vaccine for flu, a vaccine for HIV, and maybe also ways to deal with that antimicrobial resistance problem, which have come a long way in that last year. So my town hall speech has already gone on too long, but I think you get the sense. There's a long list of things we could point to in just this last year. And in case anybody thinks, well, that's fine, but is it really worth the money? It's also the greatest return on investment of anything that the government spends money on. $8.38 of return in 5 years from every dollar that you all allocate to NIH because of what happens in terms of its economic impact.
Collins, what I do in my town hall meetings, in wrapping up and concluding, and then I have another few paragraphs as well. But you have a great story to tell, and I appreciate you reminding us of those successes. Thank you.